بسم الله الرحمن الرحيم.
Bismillahirrahmanirrahim. Hope you all are fine. Today we will discuss a medication called cholecalciferol. It is commonly known as vitamin D3. It is recommended in vitamin D deficiency. If we talk about the dosage forms, there are 4 dosage forms: tablets, capsules, oral drops, oral and intramuscular solutions. If we talk about the route of administration, vitamin D can be taken orally or intramuscular. If we talk about the strength, there are different strengths which depend upon the need of the individual patient. In other words, we can say that it depends upon the patient compliance. If you talk about the indication, then as per European and American recommended guidelines, the recommended daily allowance in case of infants 0 to 12 months is 400 international units daily. In case of individuals from 1 year to 70 years, 600 international units daily. And in case of individuals 71 years and elders, 800 international units daily. However, in pregnant and lactating women, 600 international units daily is the dose for vitamin D. Vitamin D in excess of 400 international units cause side effects, so we must avoid such high doses. This medication is recommended in familial hypophosphatemia, osteoporosis, osteomalacia, rickets, multiple sclerosis, respiratory infections, tooth cavities, and so on. If we talk about the dose in case of vitamin D deficiency, 50,000 international units per week for 6 to 12 weeks. In case of osteoporosis, fractures, 400 to 1000 international unit per day. However, in case of bone loss due to corticosteroid use, 0.25 to 1 microgram per day of vitamin D in the form of calcitriol and alpha calcidol. Both these are metabolites, or you can say these are different forms of vitamin D. In case of heart failure, 800 international units per day in the form of cholecalciferol. In case of hyperparathyroidism, 800 international units for 3 months. In case of multiple sclerosis, 400 international units. And in case of elderly tooth loss, 700 international units. It is also recommended to use vitamin D in children to prevent respiratory infections. For that, 500 international units per day of cholecalciferol is the recommended dose. If we talk about administration, capsules and tablets must be swallowed whole, and injectables can be administered intramuscularly or orally with a glass of water or milk. However, in case of drops for children 2 years of age and older, you can mix the ingredients with food or other liquids like water or any juice. However, in children younger than 2 years of age, you can mix the ingredients with bottle nipple. You can put drop of liquid on pacifier mother or bottle nipple and allow baby to suck for at least 30 seconds. If we talk about storage, it is recommended not to store vitamin D above 25 degrees centigrade and cool and dry place. If we talk about drug interaction and contraindication, this medication is contraindicated in hypercalcemia, hypercalciuria, nephrolithiasis, nephrocalcinosis, and hypervitaminosis, severe renal impairment. Moreover, thiazide diuretics reduce the urinary excretion of calcium, so calcium levels must be monitored while giving vitamin D. Moreover, excessive dosing of vitamin D can induce hypercalcemia, which may increase the risk of digitalis toxicity and serious arrhythmias due to additive inotropic effect. The ECG and serum calcium levels of patient should closely be monitored. Glucocorticoids, steroids may increase vitamin D metabolism and elimination. Capsules are not recommended in children below 12 years due to risk of choking. Dose adjustment is not recommended in hepatic impairment, however, it is recommended in renal impairment. In case of pregnant and lactating mothers, 400 international unit is the safe dose. If we talk about fertility, vitamin D is not expected to have any adverse effect on fertility. It is safe to give vitamin D during pregnancy and breastfeeding. If we talk about warnings, then it is important that vitamin D must not be used in renal patients with having renal stones. If we talk about laboratory changes, there are no laboratory changes. Side effects, there are no major side effects. Special population, patients with renal insufficiency. Natural sources, vitamin D can be obtained from salmon fish. 3 ounces of salmon fish give 794 international units. 1 cup of cereals gives 40 international units. 1 yolk give 40 international units, and fortified milk 1 cup give 120 international units. Overdose can result in severe cardiac arrhythmias and soft tissues calcification. Thank you so much for watching this presentation. Hope you have got basic knowledge about vitamin D, its administration, its storage for indoor as well as outdoor patients. You can ask any question if you have any query regarding this. Thank you so much for